Good morning, everyone. Thank you for coming and welcome to Shaker Heights. We appreciate you all coming out this morning. We picked a beautiful day to hold this. This is a day that many of us have been waiting for 3+ years to gather, and we're very excited to be here. So I'm going to first turn it over to my good friend, Chris Ronayne, the county executive, who's been an incredible supportive partner in this. And so turn it over to you to welcome everyone.
Good to see you. Thank you. Mayor Weiss, thank you. And to the team from Shaker Heights, thanks for hosting today. I'm Chris Ronayne, your county executive. This is a special day, and I'm going to tell you a few reasons why. But first of all, to have 5 mayors collaborating on a joint initiative here in Cuyahoga County is what really was the aspiration of our new charter of Cuyahoga County, that we were going to work together, and today is a testament to that. Before I get too far in, I think it's somewhere in my notes, but I tend to go off script. I want to thank our frontline partners, the women and men of our police department, our fire departments, and our EMS up there too. But thank you for all you do. Thank you. Thank you. A snowy night last year, a few staff members and I, our safety director, Brennan was with me, went out to see a presentation at the city of Shaker Heights. And that presentation was inspiring. It was how a community was working together to de-escalate situations where appropriate by offering a mental health specialist, a social worker in the field to accompany the Shaker Heights Police and the Shaker Heights Fire Department. And their actual data on what they accomplished was further inspiring. My takeaway was that persons with mental health challenges were better served in this community by law enforcement partners, by the city, and ultimately lives were saved, suicides averted. And we were taken at hello in our meeting at Shaker. Cuyahoga County was. Mayor Weiss, a few months later, called me and said, it's time to scale this. And the mayors that are in front of you today are part of our pilot scale, a regional initiative to bring law enforcement and where appropriate, our mental health specialists together to do good things in our community and show a best practice that we hope we can scale to 59 communities in Cuyahoga County. That's my off the record notes, but I want to say to you, good morning. I'm happy to be here. And today we are announcing a collaborative crisis response program to better serve residents who have mental health needs. I want to thank our media partners for being here today. This is important, and we often deal in the world of urgent and important. This is both important and urgent, and I'm glad you're here. The program that we're announcing today is called First Call. Crisis assistance and local linkage, that's the L's in the call, but first call. It's about working with our local teams, police, fire, and EMS, to make sure that our dispatchers are recognizing when the appropriate call to you should accompany a mental health worker. It embeds the full-time social worker with our police and fire departments to improve the response to those suffering from a mental health crisis. As someone who's had the privilege to work with local law enforcement for 20 years, I know the situations that my chiefs have told me, and now our sheriff, when we need your help, when we need a mental health worker's help. This doesn't weaken law enforcement. It only strengthens a partnership to get our citizens what they need. And I thank you, those who've stepped up on the front line to embrace this. All of you out there, thank you. This program is an expansion of one that began right here in Shaker Heights, as I said. And for now, the next 2 years and beyond, we hope these 2 years with these communities, but our communities throughout Cuyahoga County as we grow this program. In the interim, in these first 2 years, it'll be funded by each of our 5 cities. Thank you for seeing the reason to put your skin in a game. But it's also funded by the Adams Board, the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. Scott Osicki is going to be up in a minute to speak, but they gave $523,000 to the effort. We are lucky to have good grant writers. Here, Frank, I think first from Shaker Heights, who helped organize a grant from the Office of Community-Oriented Policing Services, known as the COPS Office of the U.S. Department of Justice. Together, they amassed $400,000 for this effort. And I see representatives from our community partners. I always talk about the public-private nonprofit partnership. We are lucky in this town to have the foundation and philanthropic partners that we have. So I want to say to Tony Richardson, the CEO of the Gun Foundation, thank you. You stepped up. You said we'll support it. And to Marcia Egbert, the program officer, I appreciate your work immensely. We couldn't do it without you. You got us to the point where we can scale this for 2 years. So to Adams, to our federal partners, to the George Gun Foundation, and yes, Cuyahoga County kicked in along with the mayors. So together, we're bringing forth this program and we can launch. I commend our city leaders for moving the needle on this program, for thinking outside the box. What we're trying to do in Cuyahoga County is mine good civic ideas like we've seen in Shaker, which we've done. And we can now scale. And now it's my honor to also introduce, and they're going to speak in a minute, in addition to Mayor Weiss from Shaker Heights, the mayor of South Euclid, Georgine Welo. Just raise a hand, say hello. And the mayor of Cleveland Heights, who I think is coming, is Kahlil Seren. He's here. Excellent, Kahlil. I didn't even see it. Thank you. And thank you for all you do in Cleveland Heights and beyond. To our mayor of University Heights, Michael Brennan, thank you. And to our mayor of Richmond Heights, Kim Thomas, thank you. And her Chief Williams, you're going to hear from as well. These are the 5 cities that are stepping into this pilot to frankly do business in a different way. And we hope to really move the needle on justice upstream and on health upstream and things that our community has long needed. I would also like to take a moment to express my appreciation. Here it is again, guys, to our first responders. We cannot do this without you. Let's give them a round of applause, man. It's inspiring to see your openness and how you want to go about this with us, and we're going to learn from each other. Be remiss if I didn't thank our county council president, Pernell Jones, for being here and for the support you give us for initiatives like this. Thank you, Pernell Jones, too. I have a number of department directors. I see David Merriman, who heads up our Health and Human Services operation, and again, Brandy Carney of our safety team. And I appreciate, Adam, you being here from Metro Hospital. Thank you. Give them all, appreciate you guys. Every one of you. And back to our first responders, you work tirelessly every day on the front line to serve the public. And sometimes it's unheralded, and we just appreciate, again, this model that I think is going to be mutually appreciated across all sectors of town. So thankful also to our city, Shaker Heights, and the fire department. I learned so much from Chief Sweeney about what a fire department actually does on a daily basis and how they go about it. Things that people need help with in mental health challenges, simple things like hoarding, that we say simple, but it's a very complex situation for a family. Again, a fire department personnel in working in a home with a mental health worker, de-escalating a situation and finding solutions, it matters. We've long seen our first responders dispatched to the scenes, again, sometimes without resources. So to have their resources, to have extra resources at their hand is everything to us. To have social workers trained to handle sensitive situations. And I will later introduce Shona from Recovery Resources, who is going to tell you a little bit about how that works, and Annette, who's been in the field from Recovery Resources over to Shaker and has just proven how successful this will be. So it's now my pleasure to start to introduce our mayors. I think they're going to introduce each other, but I'm going to introduce our first mayor on the docket today, and that is the tireless mayor of South Euclid, who's been many years the mayor serving. And I'm grateful also for her council. Ruth, I saw you here, our council members that are with us today. But let me just now introduce Georgine Welo to talk a little bit about the regional collaboration that's at work. Thanks, Georgine.
I stand here with goosebumps. Seriously. We face so many challenges as local, governments and leaders. Could be transportation, could be economic development, but when it comes to health and human services, we as small communities do not have the funding nor the resources to do what we're going to do today in rolling out First Call. But most importantly for us is we want to continue to build livable communities. So we as leaders must encourage a greater regional cooperation with programs such as First Call. Programs such as this is going to help governments to meet and work the challenges by us growing cooperatively together. Cross-jurisdictional solutions, in turn, demand cross-sectional collaborations. And today, our communities and the county are creating a new collaborative alignment. This is just a first step of enormous change in our society. Always, it's been just us. Keep the walls up. We can do it. Well, we can't. This effort and others across the county are forming. You're going to be hearing things in the near future about more shared finance directors, building more on partnerships to help our seniors, looking at how can we expand just the smallest thing like our food truck parks in our communities are growing. And this year we did a 1 day of actual inspections, 70 some trucks. In South Euclid, we're looking at how can we build the first regional housing and building department. These new collaborations will help in how our policies are shaped and how places are made, but it's also going to show us the possibilities and restrictive limits of our regional cooperation. Everyone sitting here knows that I can't wait, and I don't know if I'll be the mayor, but I plan on living in Cuyahoga County. Maybe we'll have our first fire district. I can only imagine the services that we could give, having our regional 911 service and dispatch, moving to this. In South Euclid, we even have our senior care team that goes out because we know without each other, we will not continue to meet our challenges in this competitive manner and this world. And that's why I stand here today hoping that after 20 years of being a mayor, we're off. We're not on home base. We're rounding the curve and we're going to hit that home run. So I'm really excited and thrilled to be with the mayors. And I really want to thank Shaker Heights for stepping up and doing this, as it was a dream of ours with our old Chief Stepko. And, unfortunately, we just didn't have the resources. But Shaker Heights, being the leader in this region, stepped up and really looked at the importance of what it is to expand a program that is going to help more than just their community. And I say thank you. Next, I would like to introduce Mayor Kahlil Seren from Cleveland Heights, and he's going to talk to you about what this means for his city, which is also the same for all of our cities. Thank you.
Thank you. Thank you all for being here today. Again, thanks to Mayor Weiss for beginning this process with all of us and inviting us to participate. Our cities need this. I know I speak for the city of Cleveland Heights when I say there are people in my city who need help. And it's not always that immediate, urgent, in the moment help that our first responders so ably provide. Sometimes the help that people need is a more ongoing, higher touch, chronic help, a help that goes with them through their life. I know we talk a lot about mental health services, and mental health services are very intimately connected to all of the other services that we as people need to live healthy, productive lives generally. What I anticipate this doing for my community is not just helping the residents of my community, but helping our first responders as well. Now, fire and police, they, better than some of us, know collaboration. Whether it's mutual aid at the scene of a fire, or if it's working cross-jurisdictionally with other police departments and other levels of government and law enforcement, our first responders know how to work well with others. This is going to be a lesson to all of us to do the same, to take that example, and really provide the kind of meaningful and substantive assistance to our first responders so that hopefully what we end up with is a situation where run volumes, which have exploded in our community for EMS service and fire service, will go down because we are addressing some of the chronic needs that our people have and maybe avoiding that 911 call. This is the kind of benefit that we all hope to bring to our communities. I thank all of you for being here, everybody who made this a reality, and of course, everybody for being here to celebrate the launch of this program. And with that, I'm going to introduce Mayor Kim Thomas of Richmond Heights to tell us what it means for Richmond Heights too.
Good afternoon, everyone. I was praying about my voice. I was like, I just hope my voice don't go out. But I want to start off by thanking Mayor Weiss just for launching this and allowing Richmond Heights to be a part of it. And thank you to all of our community partners for making this possible. And I don't want to leave out my friend, Chris Ronayne. He always answered the call. So Chris, I really appreciate you for being a community partner. For Richmond Heights, what does this mean? For me, I look at it as a life and death situation. In Richmond Heights, we have a population of 10,800 residents, and we are starting now to see the need for this program. And at one time, I could say it doesn't happen in Richmond Heights. We don't see homeless people walking around and asking for help. We're starting to see that. And so for us, what it means is that now we have a licensed professional that can address our needs and that could actually help our first responders. Now, I call it that heavy lift. The licensed professional, she's the expert or he's that expert, and he's going to do the heavy lifting for our first responders. And so what that looks like from our first responders, now they can concentrate on what they're good at, and that is community service and community policing. And so with further ado, I am going to pass it over to my chief. And my chief is going to explain the benefits of this program and not only Richmond Heights, but in all of the other communities. So again, I thank you all for being here. I thank you for making it possible. And it's been a long time coming, and we are very, very thankful and grateful for this program. So thank you. Chief Williams.
Thanks, Mayor. I think we went a little bit out of order here, so I'll try to be brief here. I'm sorry, I got too many phones going on, and I got a little bit of what the mayor has, so excuse my voice also. But I want to start off by thanking Mayor Weiss. I definitely want to thank Chief Hudson, Chief Sweeney, the folks here at Shaker Heights. I have to thank the commander. Where is he? Hey, Commander, how are you? I'm sorry, I'm trying to bring my notes up here. When I was in Cleveland, I had somebody that did this for me, and she jumped ship on me, and she's over in the corner. So now I have to kind of do it on my own. I'm sorry. Forgive me for the delay. Our county exec, Chris Ronayne, thank you, sir. Mayor Weiss, again, the fire chiefs, the police chiefs, all of our partner chiefs from the 5 cities and from beyond, because this is not an issue just here in this upper part of Cuyahoga County. This is a nationwide issue. The police officers and the firefighters, paramedics, EMTs that are here today, they understand what this problem is. We've talked for decades and decades about having assistance for our first responders in this regard. I've said time and time again, a police officer, and I know our Adams board folks are here. They do great work. They've helped us out a lot over the last few decades. But a police officer with that 40 hours of CIT training is no match for a clinician who's done this for most of their adult life, who's trained, who's been educated on these subjects. And to have the outcomes that we need for our communities, we need that professional there with that first responder. So I applaud this program. We started similar programs when I was in Cleveland, but we're hoping that this is the program that kind of spearheads it to develop throughout Cuyahoga County, throughout the state of Ohio, and throughout this nation. This program has been needed, again, for decades. We've tasked our first responders for too long to go out there and do the job that we're really not trained to do. We're really not equipped to do. But with that being said, our first responders have done an admirable job and had kind of put a Band-Aid on things and kept this together for years and years and years. So again, I applaud the folks in the room that have come together with funding, with support. Annette, where are you, Annette? Oh, she's right there. Annette and her team and the things that they put in place and the work they've done in Shaker Heights to get this thing off the ground, it speaks volumes for what's needed. It speaks volumes for the support that we're going to get now. It takes a little bit of the load off our first responders, and it lets them know that we're not in this fight alone. So I just want to say thank you guys for this. We have to keep this going. We have to grow it. Adams Board, county, state, funding. We have to make this thing grow. I mean, this is a benefit for our entire community. You know, it starts with benefiting those residents and folks that we encounter that are in crisis. It starts there, but it helps our first responders, and in turn helps our cities and our communities to grow and to do what they, you know, what people try to do every day, and that's live a nice, peaceful life and take care of their families and you know, enjoy their communities. So again, thank you for this. Let's keep it going. Let's build on it. Our first responders, I can't thank you guys enough, and the women, men in public safety. I can't thank you enough because, you know, we've done this for so long and now we have some help. So let's make the best of this. So with that being said, I'm going to bring up, I have my glasses on, Mayor Brennan from University Heights. Thank you.
Thank you, Chief Williams. As the chair of the former Heights Hillcrest Communications Center Council of Governments, Mayor David Weiss and I had occasion to discuss at length what would become known then as the Mental Health Response Program, or the MHRP, an initial pilot program in Shaker Heights for identifying situations where dispatching a licensed independent social worker in addition to or instead of the police, fire, first responders, to then expand into University Heights and to the other Heights Hillcrest cities. We have watched with great interest and attention the successful piloting of this program, the strides that have been made in public health and in public safety. Now with the grant funding from the Adams Board and from the USDOJ COPS grant, the State of Ohio SCIP grant, the Gun Foundation, and Cuyahoga County, we here in University Heights will soon be able to dispatch a licensed independent social worker in select and appropriate situations. I'm pleased to report today that last night we passed, and this morning I signed the ordinance formally authorizing University Heights to join our partner cities, Shaker Heights, Cleveland Heights, South Euclid, and Richmond Heights, in the Crisis Assistance and Local Linkage, or First Call program. This is a major advancement in public safety and public health for University Heights and for all of the Heights Hillcrest cities. What it means to our city, simply, is getting vital care to people who need it. It means meeting people where they are. Simultaneously, it means a better use of our resources through diversifying our approach and through further acknowledgement that 911 calls do not have a one-size-fits-all response. Like all cities, University Heights has its share of folks who call 911 for want of another resource to get them the help they really need. With the First Call program, University Heights and other Heights Hillcrest cities will be better equipped to meet those needs and better serve our community and our constituents. In the immediate view, the residents of our communities will be better served. And in the long view, I foresee, and all of us up here I think foresee, that this expanded pilot will not only be successful in our 5 cities, but will serve as the template for further expansion, countywide and beyond. My thanks to my fellow mayors and elected officials, especially Mayor David Weiss for his vision, to County Executive Chris Ronayne for his vision, to our police and fire chiefs, our first responders, our law directors, to Metro Health's recovery resources, and to all those who have made this possible. It's my pleasure now to introduce my colleague and friend, the one who probably is, if I don't think there's anybody more responsible for this than he, Mayor David Weiss of Shaker Heights.
Well, I guess it shouldn't come as any surprise that I'm I take those compliments very seriously, but there are so many people that helped bring this day to pass. So let me just start by giving you a little bit of the background. Um, Over the years, we have all recognized and acknowledged the need for growing need for mental health services in our community. We saw those numbers, statistics in Shaker Heights, and we see them locally as well as nationally, how those continue to rise. And so we recognize the need. The question was then how best to make this happen. So we started with once again you'll hear this word collaboration or team partnership that really made this start. So we started with the administration. Jerry Chaikin, our chief administrative officer, really led the charge on this. But then we brought in others to assist us. Our two chiefs, Chief Hudson, Chief Sweeney. And we also had a community engagement. We had a group of very passionate residents who felt very strongly about the need to provide immediate mental health services in our community. And so we studied and we looked at all the models that exist across the country, and there are many. But what we tried to do is tailor this program to what we thought we needed here in Shaker. And the way I describe it is we really focused on three areas as the foundation for our program. One is to help those that we know in our community that need mental health services, who may have no longer received them for any number of reasons, but we know they need their help. And so we can be proactive in addressing those needs. Then we have a second group where we don't know that they have mental health needs, but we find out about them, unfortunately, usually in the context of a crisis. And those are the ones where the foundation of this program is based upon having mental health professionals on site in real time to be able to address those issues, take the pressure off our first responders, and provide a better service to our residents. So in 2022, we started our pilot program, and I'll let Annette and others talk to it, but we've had terrific success in the results that we have seen. I should say, though, that this expansion, as some of the other mayors have mentioned, this is nothing new to us. This is a topic that the five of us who were in the and still remain in our joint dispatch, these are the things that we talk about when we get together. How can we provide better services more efficiently, more cost effectively, and more broad-based and collaborative on a regional basis? And so from that group, we started the pilot, and of course, we reach out to our other stakeholders, not only the mayors, but our dispatch. Chagrin Valley Dispatch has been a key partner with us in this process. And of course, the chief executive, Chris, has been just amazing through this. We started talking about this, I think, probably 4 or 5 years ago when we talked about what we might be able to do in this area. And Chris has been nothing but supportive throughout that process. So I'm going to turn it over in just a moment to Annette, but let me just say that the fundamental concepts and basis for this program will be on-site licensed clinicians as well as peer support professionals. What makes this also different is that we will also have a licensed mental health professional in our dispatch so that he or she is able to help bring the resources needed, make sure the appropriate services are brought and dispatched effectively. I'd also like to thank our partners at Metro Health and Recovery Resources. They are partnering with us by providing the mental health professionals, and we thank them very, very much for their assistance. So with that, we are very proud and very thankful to have gotten to this day. But we also are very grateful to all of you and all of the people, including our residents, who have been so instrumental in getting us. So the good news is we're here today. The next day is we go to work big time in rolling this out in all of our communities, and we look forward to that challenge. So with that, I'll turn it over to Annette Amistadi, our lead mental health professional on the program.
Good morning. Thanks for that introduction, Mayor. I'm happy to be here with my two best bosses. I've got Fire Chief Patrick Sweeney and then Police Chief Wayne Hudson. I'm here to talk about some details about the mental health response program here in the city of Shaker Heights. The program, as mentioned, began in January of 2022 in partnership with Metro Health Recovery Resources. The program hired a licensed mental health clinician to work in the city to address the needs of the community by providing the right service at the right time. The program responds to eligible crisis calls made to our dispatch center simultaneously with, but separately from, our first responders. Once on scene, the clinician acts as a resource to both our neighbor in crisis and our first responders. The clinician can assist in de-escalation, discuss the next steps, and review community resources. The program and first responders work as a team to assist our neighbors in crisis and achieve the best possible outcome. The mental health response program responds to call types such as welfare checks, family dispute, or suicide in progress, and may also respond to calls that initially were not identified as having a mental health component, such as a theft, traffic stop, or a fire. In 2023, the mental health response program received 645 referrals. Some were responded to in real time, and others received after working hours. The program completed 723 post-crisis follow-ups, which were to link our neighbors to appropriate services and address any barriers that may be present. The mental health response program also provides training to our first responders in the areas of common mental health disorders, emergency admission procedures, de-escalation, and many other topics. So at this time, I will turn it over to Shona from Recovery Resources.
Good morning, everyone. It is a great day in our community. My name is Shona Gorant, and I'm the president and CEO of Recovery Resources. 3 years ago, our journey today started 3 years ago with the city of Shaker Heights, the Metro Health System, and Recovery Resources, really identifying the growing needs of our community for crisis assistance and linkage to mental health services, as rates of anxiety, depression, and substance use continued to increase at a rapid pace. We saw great outcomes with the Mental Health Pilot Response Program, and we're excited and proud to be here today as we expand the program in collaboration with the cities of Cleveland Heights, Richmond Heights, South Euclid, and University Heights communities, as well as Chagrin Valley Dispatch. In healthcare, we often use the phrase, providing the right care at the right place and at the right time. Our police, fire, and EMS first responders have provided exceptional service in responding to the growing needs of our community with specific responses and protocols based on their training and education. As we know, though, as the needs of our community evolve, we have expanded, making initiatives such as the CALL program so important. We're adding to the first responder team by leveraging licensed mental health professionals whose expertise is in assisting individuals in crisis. This effort will connect individuals in need to the best resources throughout our community. There are countless benefits as we increase linkages to community behavioral health providers and other health and human services while reducing reliance on the criminal justice system and emergency departments to address underlying mental health and substance use conditions. 5 years from now, 10 years from now, we're going to look back and realize this is how we do business going forward. And I am really proud that we're all together today to start that journey together and continue what we've built upon in partnership with Shaker Heights in the community. Thank you, Executive Ronayne, Mayors Brennan, Seren, Thomas, Weiss, and Welo, chiefs and community leaders, and our funders in our community for the opportunity and the trust to collaborate as we serve as a partner in this expansion of the CALL program. We're incredibly proud and honored to be with you today. And at this time, I'd like to introduce Scott Osicki. Scott is the CEO of the Adams Board. Thank you.
All right, thanks, Shona. And it's a pleasure to bring up the rear of all of our speakers today. So once again, I'm Scott Osicki. I'm the Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services Board of Cuyahoga County. I have to say that today's announcement of a new collaborative crisis response program is perfect timing because May is National Mental Health Month, a time dedicated to raising awareness of mental health issues. In fact, I want to applaud Shaker Heights for bringing together this 5-city initiative that crosses traditional municipal boundaries to provide needed crisis response for members of the community living with mental illness. The Adams Board wholeheartedly supports the expansion of the First Call Crisis Assistance program, and we're pleased to be the largest funder of this expansion. The Adams Board has designated over $500,000 to fund this expansion for its first 2 years, and we're so proud to invest in expanding this continuum of crisis care, first made available to the residents of Shaker Heights, and now to the people living in Cleveland Heights, Richmond Heights, South Euclid, and University Heights. This partnership between the Adams Board, Cuyahoga County, the mayors, police and fire departments, and the cities involved, along with recovery resources, truly expresses the understanding and importance of providing crisis and follow-up treatment and recovery support services to individuals when they need it most and where they are. By intervening early, these teams promote treatment, recovery, and show the community that mental health is taken seriously and with the care of the individual in mind. The expansion of Shaker Heights' successful mental health response program shows that alternative crisis response programs are successful and need to be prioritized. The Adams Board is looking forward to receiving the good news, the metrics from this expanded program to illustrate further success and sharing what we learned from our own upcoming care response pilot program with the City of Cleveland. The Adams Board not only supports this program financially, but also supports it philosophically, because we know that when help is provided in a crisis, it's important to the individuals, families, and the communities to having caring options available to them. So once again, thank you to everybody, and I will turn it over back to our county executive.
Thank you, Scott, from the Adams Board, Shona of Recovery Resources, Annette, now with the Shaker Heights team, came over from Recovery Resources, to Chief Williams, and to our mayors, again, Kim Thomas, Mike Brennan, Mayor Seren, Kahlil Seren, Georgine Welo. Thank you, mayors, and notably Mayor Weiss. He is the partner that pushed and pushed and pushed. I see you brought your sister today too, and some of the family. Good. We're all a family. I just wanted to say one group that may be out here, a few of you I know, that are also frontline providers in addition to our police and fire team, are our social workers, are our mental health specialists. Can we give them a round of applause for being here? To have you all together on the front line is truly what this is about. Collaboration into making our communities, frankly, work better and work smarter for our residents. That's what this is all about. We are about providing, as Mayor Weiss and every other mayor said, resources to our community to have our team in law enforcement paired with our social workers and our mental health specialists right out of the gates at dispatch. That's what we're trying to achieve. So on the collaboration side, hats off. It's a big crowd today. It should be. It's what the county and its communities are supposed to do. Mayor, I just say one other thing on the visit to you in that winter night last year. It was one of my first visits as a county executive to a community. He invited me, and Annette's presentation and Jerry Chaikin and those that helped put it together. I want to thank also the administrators, that are with us. There's a lot of law directors with us today, finance directors. Thanks for every mayor putting skin in this game, and city manager out here today. You know, it takes this whole effort on the public side to serve our citizens. But the presentation that he had me at Hello was when Annette ran through the first year numbers. And those first year numbers showed what a difference was made. I think there was in just a very short time, she can give you all the specifics on the numbers, but by my count, we were into the hundreds in terms of calls. But the subtle line that just she humbly presented was that my remembrance was 7 averted suicides in that mix. And it's everything, right? We're giving people the care they need at the moment they need it in a different kind of way where we think out of the box. And that's what the First Call program is about. It is about linking community to resources. So thank you, partners, community, funders, all of you that helped fund this. Again, grateful to Adams Board for funding, grateful to our U.S. Department of Justice, Cuyahoga County, thank you, Council President. You always have to approve my bills, and the mayors. But I also have to say to Tony, thank you. You know, to the Gun Foundation, Marcia, thank you. You got us over the goal line. You know, Scott was the first in, and thank you. And you were the last in that we got over the goal line to get not 1 year, but 2 years. And that was thanks to you. So our philanthropic partners really matter. Give them a round of applause, please, and I'll wrap this up. So this is you, our family of support specialists in every way on the front line, helping with those in need in crisis response and with mental health needs. We can achieve more compassionate, effective, and safer outcomes for our citizens and for our workers. This approach not only improves the safety of our responders, but also fosters hope in every community. I'll have one hope to give you, that we scale this beyond our 5 communities, that this pilot works, and in 2 years, we're back looking at the next 5 communities or beyond, that someday 59 communities see this in their community as a team working out of dispatch and frontline that's serving the community. Regional collaboration, we build on Shaker's blueprint. I probably should introduce my director of regional collaboration, Chris Alvarado, who's with us today. Thank you. And also Laura Demansky-Diaz, who's joined us as our Justice and Health Equity Officer, is going to be working a lot with you. I mentioned our team from HHS. David, thank you. Obviously, Council President Brandy Carney from the Safety Department. And Colette Woodard, thank you for putting this together today. And Jen Chach, who was Calvin Williams' right hand when he needed a lifeline, but now he's ours, Chief. And thank you. So we're going to wrap this up. I'm going to throw my team a curveball, and I hope our members of the press appreciate this. We're going to be ready for questions over here. But I would say if you want to offer open questions, sometimes journalists get smarter by listening to other journalists. So, you know, I'm looking at you. So if you have any, give them. Thank you. Yeah.
Yes. So the mental health professionals and a certified peer support will work as a team. So we will hire 4 licensed mental health professionals and 3 peer supports. And then they will be reporting to the city of Shaker Heights. And then we will distribute to the cities after that.
So in South Euclid, we have it here on Monday night. Our council president, Ruth Gray, is here. This is near and dear to her heart, and she wasn't going to miss this. So we're very confident and we're excited about it.
Thank you, Mayor. Ours is scheduled for May the 14th. Our city council president is a licensed social worker.
So our next opportunity would be May 20th, but we may not have to take a legislative step because the threshold for this expenditure is at a level where I can make this myself. So
I couldn't pass up the opportunity to mention something that I forgot earlier, and that is the support of our city councils. Ultimately, they really, we report to them, and they have been very, very supportive. In Shaker, in particular, council members Ann Williams and Trey Roeder were tireless advocates for this program as well. But all of the councils, we can't do this without their support. So thank you to the mayors, but also to their councils.
Well, if not, it's a pleasure being here at Firehouse number 1. Mayor, it was a pleasure being with you last year when you really got us motivated at Cuyahoga County. But seeing Chief Sweeney and Chief Hudson and the presentation that was given by, again, Annette, you inspired us. That's what we go. We go out and mine for civic ideas. We found one. We're scaling it thanks to your leadership and all the mayors who are here and their council members. Thank you. That's a wrap. Firehouse number 1, or somebody has provided some cookies and early appetizer before lunch for all of you who've been standing up for an hour. Enjoy. And again, thank you everybody on the front line. Appreciate you. Thank you, media, for being here. That was great. I think we're going to get one picture with